aloha. My name is Christa Braun-Inglis, and I'm a nurse practitioner and associate researcher at the University of Hawai'i Cancer Center. I also work clinically at Hawaii Pacific Health. I've been in oncology nursing for over 30 years, and I've been a nurse practitioner for just about 23 of those years. So I'm very passionate about the role of NPs and APs in general, what they can bring to oncology, but I know there's a lot of struggles sometimes for new APs to get on their feet once they graduate. And I've seen this with my colleagues in Hawaii. I was actually fortunate enough to have a really great foundation and was hired into a practice that had already had APPs on the mainland. I lived there for a few years in California. So when I came back to Hawaii, and I was actually the first NP when I moved back to Hawaii practicing in oncology, I'd see even our practice hire other NPs, and they were like, well, why are they not ready to go? Like, why can't they do what you can do? And, in all of the, and I'm like, they need mentorship, they need onboarding. And look, in seeing over the past 10 years, our field really growing and knowing there were so many new APPs out there and seeing these fellowship programs pop up across the country and then thinking, could we do this in Hawaii? Well, it's really hard to because we don't have an academic medical center. But one thing I did have was I had a faculty position with the Cancer Center, and I had a faculty position with the School of Nursing that had the largest DNP program in Hawaii. So, and I was actually going back for my DNP, and I was meeting students, and they're, oh, wow, you work in oncology, and just interested. And then one of my physician colleagues was like, I need to get an NP, but how do I get an NP? And I said, well, let's think about partnering and growing our own in Hawaii, because we don't have great retention of people moving to Hawaii and staying when they move as adults and as professionals. It's different. It's a different culture. It's far away from the U.S. mainland. And many times you're far, and it's expensive to live. There's all of these things. So, and why wouldn't we grow our own? So we paired with the UH School of Nursing, as I mentioned, and started to do what we called an oncology paired preceptorship program. And we used ONS NP competencies as a guide on what we wanted those students to focus on. Not all of them, because it's a large body of work. But we pared that down, focused it, found preceptors in the community, so doing an academic community partnership, and we had them do their last clinical rotation with an oncology nurse practitioner. So we were really successful from 2021 to 2023 of having 8 students participate in this program, and now 4 are working in oncology, and they've retained their jobs. Nobody has left that took a position, that was interested to take a position. So we have a 50%, I always say accrual because I'm involved in research too, but we have a 50% success rate right now. But we also surveyed our participants, and we surveyed the NPs. We surveyed some of the docs that they're working with, and we also surveyed the students. And we found that, they wanted some more lectures, because we did offer them some recorded lectures initially. Some people wanted them to have 2 semesters, so looking at 2 semesters. And we also talked about incorporating clinical research, because that was a request from one of the NPs and one of the physicians as well. And that's my other love, getting NPs and APPs involved in clinical research. So we've expanded the program now to 2 semesters. We have more of a formal relationship with the School of Nursing and with the different community partners. And we have 3 students going through it right now. It's 2 semesters. The first semester is an introduction to oncology, and the second semester is a more immersed into oncology, and we pull in that clinical research. And it's still within the lines of them getting their, population-based focused degree. But we're just really trying to prepare people to say, I really want to go into oncology, or that's what I really think I want to do. Because some people go through the program and then they're like, that's not what I want to do. And I think that's okay too, because there's so much put into hiring, onboarding, and, and then, retention, right? And turnover it can be really, really huge. And I've seen so many NPs come and go because they really didn't have a solid foundation, and the expectation when they walked into the clinic was much different than they thought. So we're just trying to do things like that to help our own local population. I would love to see this program continue to grow, and there's only about 30 of us throughout Hawaii, advanced practice providers. We don't actually have a PA school in Hawaii, so the majority of us are NPs. We do have certain PA colleagues, but where we can focus now on working with the schools is with the NP program. I'd like to start to see if we could help to do this on neighbor islands. So students that were interested in working on neighbor islands, because we have even a larger oncology workforce shortage there on our neighbor islands. So I would hope to do that. And I hope to see, APPs at every oncology practice in Hawaii being utilized to their fullest extent. And hopefully we can continue to grow that.